Welcome to the deep dive. We're going to be talking all about postpartum recovery today.
Oh, this is going to be good.
Yeah, we're going deep into what happens to the body after childbirth. So whether you're, maybe prepping for this yourself or supporting a loved one or even just curious about this phase of life, this one's for you.
Absolutely. And we're not just scratching the surface here,
Oh, no.
We're diving into the why behind all these postpartum changes, not just the what.
Exactly. I think that's what makes these deep dives so interesting.
Definitely.
And for this one, our main source is this guide for nurses on postpartum assessment.
Oh, that's a great resource.
It is. It's fascinating, even if you're not, in the medical field. Like, it really highlights how much is going on in those first 6 to 10 days after childbirth.
Oh, yeah. Those first few days are crucial. It's like the body is hitting a giant reset button.
Right. I was reading about the uterus, and it's wild.
I know. What is it? Like going from a watermelon to a softball.
That's exactly what the guide said. Like, picture that.
Incredible. And, it's not just about the size either. It's about the fundus. That's the top of the uterus. It descends like a centimeter every day after delivery.
Wow, that's pretty precise.
It is. And that shrinking is what's causing those uterine contractions.
Oh, so that's why those contractions are so important.
Yeah, they're crucial for controlling bleeding. It's like imagine a giant muscle squeezing, That's what's happening.
I see. So it's clamping down on those blood vessels.
Exactly.
That makes a lot of sense now.
Yeah, and that's why nurses are always checking to make sure the uterus feels firm, like a softball.
Oh, right. They call it boggy if it's soft, right?
Yeah, and that's a red flag because it could mean there's a problem with bleeding.
Okay. That's definitely something I didn't know before reading this guide.
Oh, it's full of little nuggets like that.
I know. And speaking of interesting things I learned, did you know that breastfeeding actually helps with those contractions?
Oh, yeah, for sure. It triggers the release of oxytocin, which is this amazing hormone.
What does oxytocin do?
Well, it helps with those contractions we were talking about, but it also promotes milk production.
Oh, that's cool.
Isn't it? It's like a win-win.
Totally. But I also know that breastfeeding can cause cramping, too.
That's true. Those contractions can feel like cramps, but it's a good thing.
It's like a sign that things are working as they should.
Exactly. It's all part of that reset process.
And while we're on the topic of signs, let's talk about lochia.
Oh, yeah, lochia, the postpartum discharge.
A lot of people just call it bleeding, but it's more than that, right?
It is. Our source material breaks it down into different stages. It goes from lochia rubra, which is bright red, to...
So that's like the initial stage.
Yeah, then it transitions to lochia serosa, which is pink.
Okay, so it's getting lighter.
Right. And finally lochia alba, which is whitish.
I see. So there's a progression to it.
There is. And it's like a color-coded guide to your healing process.
That's a cool way to think about it.
It is. But there's a point where it's too much,
Right, like if you're soaking a pad in an hour.
Exactly. That's a sign of excessive bleeding, and that's when you call your doctor right away.
Got it.
Lochia is basically the lining of your uterus shedding as it heals. And the amount and color can change depending on a bunch of things, like if you're breastfeeding or not.
Oh, really?
Yeah, even your activity level or whether it's your first baby can play a role.
Wow, it's amazing how individualized the experience can be.
It really is.
Okay, so we've talked about the uterus and lochia. Now, let's move on to something that might be a little more delicate to discuss.
Okay, what's that?
Perineal care.
Oh, right, yeah.
I mean, this is a part of the body that goes through a lot during childbirth.
It does. I'm glad our source material addresses this because it's so important.
Yeah, and it normalizes things like swelling and bruising after delivery. And the guide also talks about tearing.
Right. That's super common.
Yeah, and it could be a natural tear during delivery, or it could be an episiotomy.
Oh, right, where the doctor makes a small cut to help with delivery. What surprised me is that while most of the healing happens in the first couple of weeks, it can actually take 4 to 6 months for the perineum to fully recover.
Really? Wow, I didn't realize it took that long.
Yeah, it's a longer process than most people think.
So what are some things that can help with the healing?
Well, there are things like ice packs, sitz baths, topical agents.
It was like witch hazel, right.
Exactly. And of course, good hygiene is key.
Makes sense. Keep it clean and let it heal.
Right. And another thing the guide mentions is hematomas.
Oh, yeah. What are those again?
It's basically a collection of blood outside of a blood vessel. It can happen in the perineal area and be pretty painful.
I see. So that's another thing nurses are watching out for.
Absolutely. It needs prompt medical attention.
It's amazing how closely nurses monitor everything during that postpartum period.
They really are the unsung heroes.
Yeah.
Always paying attention to every little detail.
I agree. Okay, Let's move on to something that's, well, not the most glamorous topic.
Oh, what's that?
Bladder and bowel function.
Oh, right. Yeah, I have to admit I chuckled a bit when I read about this in the guide.
Me too.
Yeah.
It's something people make jokes about, peeing a lot after having a baby. But it's actually a lot more to it than that.
It is. It really is.
Like, did you know that the bladder can actually get over full without the person even feeling it?
Yeah, that's wild, right? It's because of all the swelling and the body's still adjusting after delivery.
So the sensation of needing to pee might be decreased.
Exactly. And that can lead to problems if it's not addressed.
Oh, wow. Like what kind of problems?
Well, things like urinary tract infections or even worse complications.
Yikes.
Yeah, so it's not just about frequent bathroom trips, it's about potential health risks.
That makes sense. So what about bowel function? What did the guide say about that?
Well, it talked a lot about constipation being a common issue. And, it actually mentioned that fear of bowel movements after childbirth is very real, especially if there were tears or an episiotomy.
Oh, yeah, I can definitely see why that would be a concern.
But there are ways to make things easier.
Like what?
Drinking plenty of fluids, eating fiber, and even stool softeners can help.
That's good to know. It's so easy to get caught up in all the physical changes. But we can't forget about the emotional side of postpartum recovery.
Oh, absolutely. That's just as important.
Yeah, and our source material actually devotes a whole section to bonding and attachment.
Oh, that's so important.
It is. They define bonding as that early attraction between parent and baby.
That feeling of connection.
Right. But it's not always immediate or easy.
Right. You're right, and the guide highlights all these factors that can influence bonding. Things like socioeconomic status, cultural norms, the birth experience itself.
Wow, so many things can play a role.
It's a complex interplay for sure.
It really highlights how everyone's experience is unique. There's no one-size-fits-all.
Exactly. And one of the biggest factors that's often overlooked is fatigue.
Oh yeah, fatigue is huge.
New parents are usually super sleep deprived, and that can impact everything.
I know the guide mentioned that sleep deprivation is linked to postpartum depression.
It is, and that's not just about being tired. It's a serious mental health condition.
Right, and it needs to be addressed.
Absolutely. And it's not just about the parent's mental health either. The guide points out that fatigue and stress can actually reduce milk supply in breastfeeding moms.
Oh, wow, really?
Yeah, so the physical and emotional aspects are totally intertwined.
That's fascinating. So it's like this whole interconnected web of factors.
Exactly. And that actually brings us to our final point for this part of our deep dive.
Okay, what's that?
Nutrition and discharge planning.
Okay, so what are nurses checking before sending someone home with their new baby?
Well, one thing that really stood out to me was the emphasis on calorie intake, especially for breastfeeding moms.
Yeah, they need those extra calories. How many was it again?
A whopping 500 extra calories per day.
Wow. But it makes sense they're spending so much energy.
Exactly. And it's not just about quantity, it's about quality too. Eating a balanced diet is essential for everyone during this time.
I agree. It's about nourishing your body for this new chapter.
Exactly. And before discharge, nurses are checking all the important things, like making sure vital signs are stable, lochia is normal, the uterus is shrinking as expected, and that the new parent is able to urinate and have a bowel movement.
It's a very thorough checklist.
It is. They want to make sure everything is on track before sending someone home.
It's incredible how much happens in those first few days after childbirth.
It really is. The body is amazing.
It is. And all that recovery and adjustment, it just highlights the importance of those early postpartum checkups.
Absolutely. Healthcare providers are there to support you and address any concerns you might have.
It's great to know you don't have to navigate this alone.
You definitely don't. And on that note, I think this is a good place for us to pause.
Okay, sounds good. We've covered a lot of ground already, from the uterus shrinking back down to the different stages of lochia and the emotional and nutritional aspects of recovery.
We've only just scratched the surface. Stay tuned for part 2 of our deep dive, where we'll explore some of the potential complications that can arise during this time.
And we'll discuss ways to manage them, so be sure to come back for that.
We'll be right back.
See you soon. Welcome back to the deep dive. Before the break, we were talking about all those incredible things happening in the body during postpartum recovery.
All those amazing transformations and that crucial early care.
It's truly remarkable how the body bounces back after such a huge event.
It is, but it's also important to remember that this period can have its challenges too.
Right, not everything is sunshine and roses.
Exactly. And our source material, the Guide for Nurses, actually lists some high-risk factors, that can increase the likelihood of complications.
Like what?
Well, things like preeclampsia during pregnancy or having diabetes or heart disease, even things like having a cesarean birth or certain complications during labor and delivery.
So those are things to be extra aware of.
Yeah, if any of those apply to you, it's even more important to watch for any unusual symptoms.
And to communicate openly with your healthcare provider.
Exactly. They're your best resource during this time.
Now, I know we don't have time to go into every single potential complication.
Right, there are a lot of them.
But are there a few that you think are especially important to highlight?
Definitely. I think postpartum hemorrhage is a big one.
Oh yeah, we touched on that earlier.
It's when there's excessive bleeding after childbirth, and it can be very serious.
That's why nurses are so focused on monitoring the uterus and lochia in those first few days.
Exactly. Remember those red flags we talked about?
Like a soft or boggy uterus and soaking a pad in an hour.
Yeah, those are signs that need immediate attention.
And if a hemorrhage does occur, what happens then?
Well, there are a number of interventions to control the bleeding. Things like medication, and in some cases, surgery might be necessary.
So it's definitely a situation that requires prompt medical care.
Absolutely. Now, another potential complication is infection.
Okay, where can infections occur?
Well, they can happen in a few different places, like the uterus, the perineal area, or even the urinary tract.
And what are some of the symptoms of infection?
You might experience things like fever, pain, redness, swelling, or unusual discharge.
So those are things to watch out for.
Exactly. Early detection and treatment are key to preventing those infections from becoming more serious.
Makes sense. So if you notice anything unusual, it's best to check in with your healthcare provider.
Even if it seems small, it's always better to err on the side of caution.
I agree. Okay, let's talk about something that can specifically affect breastfeeding mothers.
Okay, what's that?
Mastitis.
Oh, right, mastitis. It's an inflammation of the breast tissue that can be really painful.
Our source material mentions engorgement, which is excessive breast fullness. That usually shows up around 2 to 3 days postpartum.
Right, and while engorgement itself isn't a problem, it can sometimes lead to mastitis.
I see. So how can engorgement be managed?
Well, wearing a supportive bra can help, and applying ice packs to the breasts can also provide relief. And if you're not breastfeeding, avoiding breast stimulation can make a difference too.
So it's about minimizing that fullness and discomfort.
Exactly, and if someone does develop mastitis, what then?
Yeah, what are the treatment options?
Usually antibiotics are prescribed to treat the infection, and it's important to continue breastfeeding or pumping to help clear the blockage.
Oh, that makes sense.
And of course, pain relief is important too.
Yeah, I can imagine.
Over-the-counter pain relievers can help manage the discomfort.
So it's treatable, and there are things you can do to ease the symptoms.
Definitely. It's important to remember that.
Okay, we've talked about some physical complications, but what about the emotional side of things? We mentioned postpartum depression earlier.
It's something that a lot of new parents experience.
And our source material really emphasizes how common it is.
It's nothing to be ashamed of.
Right, it's a real medical condition.
And we talk about fatigue and sleep deprivation being major contributing factors.
Yeah, those play a huge role.
And the symptoms can range quite a bit, from mild sadness and anxiety to more severe mood swings. Difficulty bonding with the baby, even thoughts of harming oneself or the baby.
That's really serious.
It is, and if you're experiencing any of these symptoms, it's crucial to seek professional help.
There are effective treatments available.
Therapy, medication, those can make a huge difference.
And it's important to remember that postpartum depression is not a sign of weakness.
It's a medical condition that deserves care and attention, just like any other health concern.
Absolutely. And there are resources available to help new parents cope with the challenges of this period.
Even if they're not experiencing postpartum depression, there's support out there.
Like what kind of resources?
Well, there are support groups, online forums, even just talking to a trusted friend or family member can help.
Sometimes just having someone to listen and validate your feelings can make a world of difference.
It really can.
So the key takeaway here is that you're not alone.
There's help available, and reaching out is a sign of strength, not weakness.
I love that. Now, before we wrap up this part of our deep dive, is there anything else you wanted to touch on?
Yeah, actually there is. I'd like to bring up pelvic floor health.
Oh, right. We briefly mentioned Kegel exercises earlier.
Yeah, but Kegels are just one part of keeping your pelvic floor healthy.
Okay, tell me more about that.
Well, those pelvic floor muscles, they support your bladder, uterus, and rectum. And these muscles can get weakened during pregnancy and childbirth.
So that weakness can lead to problems later on.
Exactly. It can cause things like urinary incontinence, fecal incontinence, even pelvic organ prolapse.
Pelvic organ prolapse, what's that?
It's when the pelvic organs start to drop down. It can be a really uncomfortable and even debilitating condition.
Oh, wow. I didn't know that.
Yeah, it's not something that's talked about a lot, but it's important to be aware of.
So strengthening those pelvic floor muscles after delivery is really important.
Absolutely. Kegels are a great place to start, but there are other exercises that can help too.
And if someone is having problems, is there anything else they can do?
Yeah, a pelvic floor physical therapist can provide personalized guidance and treatment.
You know, I think a lot of people aren't even aware that pelvic floor physical therapy is a thing.
It's true. Pelvic floor health is often neglected, but it's crucial for long-term well-being.
It sounds like it.
It is. It's not just about preventing problems either. It's about enhancing intimacy and feeling good in your own body.
So it's an investment in your long-term health and happiness.
Exactly. And I think this is a good point for us to pause again.
Okay, sounds good.
Yeah.
We've covered a lot of important information today about potential complications and ways to manage them.
And when we return for the final part of our deep dive, we'll explore some practical tips and resources for navigating the postpartum period, and we'll talk about self-care and advocating for your needs.
We'll be right back.
Welcome back to the deep dive. We've been talking about all sorts of things related to postpartum recovery.
Yeah, those incredible changes and the challenges that can sometimes pop up.
And how important it is to take care of yourself, both physically and emotionally. So now let's talk about some practical strategies for, actually navigating this time.
Knowledge is power, as they say.
It really is, especially when it comes to your health and well-being. Absolutely.
So first things first, rest.
Oh, rest is so crucial.
It might seem obvious.
It does.
But it's so easy to forget about it when you're in the thick of things.
Especially with a newborn.
Right. In our nursing guide, it really stresses how important rest is for postpartum recovery.
Oh, yeah. It mentions it over and over again.
We talked about how fatigue can affect both physical and emotional healing.
And breastfeeding, too.
Right. So getting rest whenever possible should be a top priority.
Absolutely. Even short bursts of sleep can make a difference.
That's where asking for help comes in.
Oh, for sure.
Don't be afraid to lean on your partner, family, friends, or even hire a postpartum doula if you can.
Those doulas are lifesavers.
Even if it's just for an hour so you can take a nap.
Seriously, any little bit helps.
And speaking of help, our source material also talks about communication with your healthcare provider.
It's all about open and honest communication.
Exactly. Don't hesitate to ask questions, voice concerns, advocate for your needs.
Whether it's about managing pain, breastfeeding challenges, your emotional well-being, anything at all, your healthcare team is there to support you.
So if something doesn't feel right, speak up.
Always trust your instincts.
Absolutely. You know your body best.
And don't be afraid to reach out for help when you need it.
Okay, let's talk about nutrition.
Another crucial aspect of postpartum recovery.
We mentioned breastfeeding moms needing those extra calories.
500 extra.
It's a lot.
It is.
But eating a balanced diet is important for everyone during this time.
You're right. It's all about giving your body the nutrients it needs to heal and recover and thrive.
Exactly. Focus on those nutrient-rich foods.
Fruits, veggies, lean proteins, whole grains.
Aren't that good stuff?
They provide energy, support milk production, can even boost your mood.
And speaking of boosting your mood, don't forget to stay hydrated.
Water is so important.
It helps with milk production, digestion, overall well-being.
Can't forget about water.
Okay, so we've talked about rest, nutrition. What about exercise?
Yes, the burning question. When can I start working out again?
I know a lot of people are wondering about that.
It really depends on the individual and the type of delivery they had.
But in general, start slow, right?
Yeah, gentle activities like walking gradually increase the intensity as your body feels ready.
And always get clearance from your healthcare provider.
They'll help you figure out what's safe and appropriate for you.
Now, while we're talking about physical activity, let's go back to those pelvic floor exercises.
Kegels.
We talked about how important those muscles are for, bladder control, preventing incontinence, overall pelvic health.
They really are essential.
And there's something we should all be doing, whether we've had a baby or not.
That's right.
Even just a few minutes of Kegels each day can make a difference.
It's a small investment with big rewards.
And pelvic floor health isn't just about preventing problems either.
You're right. It's also about feeling good in your body.
Enhancing intimacy.
It's all connected.
So it's an investment in your long-term health and happiness.
Couldn't have said it better myself. As we wrap up our deep dive here, I want to leave you with one final thought.
Okay, I'm listening.
Postpartum recovery, it's a journey, not a destination.
That's a beautiful way to put it.
It's a time of immense change, physically, emotionally.
It's a transformation.
Be patient with yourself. Embrace those ups and downs. Celebrate the incredible strength of your body and your spirit.
You've brought new life into the world. Allow yourself the time and space to heal and adjust and thrive in this new chapter.
Well said. Couldn't agree more.
Remember, you're not alone on this journey. Reach out for support, trust your instincts, and embrace the power of postpartum recovery.
Thanks for joining us on this deep dive. It's been a pleasure.
Until next time, keep exploring, keep learning, and keep diving deep.